Tonight we have our very favorite plastic surgeons on the set talking about the rage, chin implants. We're so excited you guys are here tonight, stopping by, filling us in on the 411 on what's happening out there in the beauty world. And chin implants seem to be what the buzz is. Is there a reason why?
There is. Thanks, Deborah. The chin implant, also people are referring to as the chin plant, is a procedure that plastic surgeons have been doing for years. It's getting publicity now because our society, the American Society of Plastic Surgery, released statistics from 2011. It showed that the number of chin implant procedures has gone up dramatically. Now, it's still not performed very often, far less than breast augmentation or liposuction, but it is being performed more than it was in the years prior. The thought is, with the chin implant, you get a augmentation of your chin. You get a better jawline, a stronger jaw for men or women. So the thought is that with more video conferencing at work, people are afraid how they're coming across in video, and they're afraid they have a weak chin, and they think that for their job they need to have a stronger chin. So they're coming to the chin implant.
And I kind of would agree with that. I think not only for the job market, but with Facebook and video chat and, you know, even the iPhones now, you know, when you're talking to your family or whatever, people are very conscious of how they look. And, you know, even though the other person is seeing them, you know what, they're taking their own video to see how they look. And I think image is so important now because there's so much social media going on.
Definitely.
That's right. People are trying to come up with a way to battle it. They want to look good for themselves, their friends, and also for work. So a chin implant is certainly one way to do it. As with anything in plastic surgery, there's multiple ways to do it.
Another way of augmenting the chin is using your own bone. It's called a genioplasty, and what that involves is actually cutting and repositioning your own jaw bone. Now, it's a little bit more of an invasive procedure, and it's a little bit more of a recovery time, and there's more of a limited amount of plastic surgeons that should and do perform that procedure, but you do take the variable of the implant out of the picture. It is your own tissue. So rather than potentially developing erosion of the underlying bone or infection of an implant requiring removal or potential migration of the implant, this is your own bone. Tends to look a little bit more natural than using an implant, but it's a much more invasive procedure.
It's a permanent procedure as opposed to a chin implant, maybe not be permanent.
Right, and when you're talking about a surgery, either way, you know, it is permanent. I mean, and there are so many variables that can happen, but you know, when you do the flip side of it, obviously it's a problem or they would not be seeking help for it.
Right.
You know, and whether it's for stature or whether it's just to, you know, for some reason, the nice chin gives you a look of aristocratic nature. I mean, it really does. Authority, all of those things. Youth. You know, will it also help when you do a chin implant to, you know, for women that begin to get the chicken neck under play like I have?
No.
Will it help pull that up?
It does a little bit. It improves the jawline and gives a little more of a sharper angle, which we associate with youth. And so definitely we'll do a chin implant or the sliding genioplasty for women who are starting to have a little laxity here. We also do it in people who have a more prominent nose, and they might have a rhinoplasty. At the same time, we'll put a little chin implant in, and it balances their features.
Good. Now, who would be a good candidate for this type of surgery?
Well, I mean, it's not really age dependent. I mean, obviously you don't want to do it on somebody who's too young, who's developing. You don't want to do it on somebody who's too old, whose skin is too thin, that would show the actual outline of the implant. So anybody in their 20s to 60s is probably a good candidate for it. Obviously you want somebody who's healthy and has distinctly that one issue. You don't want to just say, oh, let me put a chin implant just because I'm not sure how to make you look better. It has to be really what they're concerned with.
And I do want to share with you that I got, probably 4 or 5 emails from women in their 70s that really are seeking some recommendations for plastic surgery because, you know, they said they really feel good about themselves and they want to look as good as they feel on the inside. And I was very surprised at that, but it's, you know, I mean, 4 or 5 emails from the 70 crowd is pretty amazing to me. So, you know, when we talk about surgery, it's really for every age.
It is.
It is.
You know?
Well, what 70 is today is not what 70 was 20 years ago. It's totally different. People are incredibly healthy. They're nutrition conscious. It's just a different age group for the most part.
It's a different age group. We're going to take a quick break. When we come back, we're going to have you answer some viewer questions. Okay?
Great.
When we come back, some viewer questions that you have sent in.
It's fashion. It's beauty.
I personally believe that every single person can do something.
It's
And
celebrity.
then you were starring in Whitaker Bay.
Whitaker Bay, which was, of course, in North Carolina Beach.
It's fun.
Holy cow, I'm on the Debra Kennedy Show. It doesn't get any better than this. It is huge.
Join us here on Saturday nights at 9:30 on Access 21 for the Debra Kennedy Show. Beauty from the inside out and the outside in.
As a mother, I understand the changes women's bodies go through with pregnancy.
Having children changes women's lives in many ways, including some they may not have foreseen. The Mommy Makeover eliminates sagging breasts, a flabby stomach, and stubborn pockets of fat.
The Mommy Makeover allows you to reclaim your pre-pregnancy body and look and feel great again. We complete the procedures in just one surgery. Expect the exceptional and regain your life. You deserve it.
And now we're back with the Dr. Criswells with those viewer questions. I'm going to start with you, Bryan, on the first question.
Sure.
And it comes to us from Joan in Clover, South Carolina. Hey, Joan. Thanks for the question. I have so many brown spots on my face. How can I erase these forever?
That's a great question. We have consultations with people every day about this question, and there's sunspots, age spots, beauty spots. It's the brown spots that people get with time and with age and with sun. So the first way is to prevent them. So to all of our viewers, sunscreen, sunscreen, sunscreen. So sunscreen is number one. Once you have them, some of the products that are available over the counter help a very small amount. Retinol products help a very small amount. But if you really want to fade them, if you really want the sunspots to go away, it's prescription strength, Retin-A, and hydroquinone. And you need to talk with your medical esthetician or your surgeon about how to go about using them. But over a few weeks of a home regimen, they will fade, and some people they'll fade away to be completely gone.
That's great. That's an easy solution.
It is an easy solution.
I love that. Okay, Kara, next one's for you. My cheeks have fallen and I want them back. I love this one. Can I get cheek implants or injections, and how much will it cost? And that's from Monica in Charlotte.
Okay. I assume we're talking about the face. We'll start there. With cheek implants, that is a very minimally invasive way of bulking up that area of the face. However, again, this is an implant in the face. It could migrate with facial movement, with age, and could cause some complications, infections. So you tend to use something a little bit less invasive than that, which would be either injectables in the form of Radius, Juvederm, or your own fat, which can be permanent. So if we're talking about the Radius or the Juvederm, usually you'll need 2 syringes. You need a good bit of product to be able to bulk up the cheekbone area. So that could run you anywhere from $800 to $1,400 for injectables. If you're going to use your own fat, it's an excellent way of improving this part of your face where about 2/3 of it is permanent. So that's something you never necessarily have to do again. And what we've seen is by fat injections to the face, they have also improved the overlying texture and quality of the skin. There are stem cells in the fat which will become the fat that they're injected into. So it really is a permanent way of bulking up that area. Now that can be anywhere from $3,000 to $5,000, but again, you're talking something permanent as opposed to the injectables, which you might need to repeat every year, every couple of years.
Right, so I love that, 2 options. You know, I love that. Okay, Bryan, this is from Bridget in Rock Hill, South Carolina. I'm 40 years old and just starting to see the signs of aging. Good for her. I want to start on a retinol cream. Will that help?
Okay, that's a great question. This goes hand in hand with the first question about the sunspots. Retinol cream can mean a lot of different things. And so really what we're talking about is over-the-counter retinols, which just help a little bit. They're not going to harm your skin, but you're not going to see a dramatic improvement. If If you want to take it the next step further, it's a prescription retinol, and that is a great way to start a skincare regimen. It removes fine lines and wrinkles. It plumps up your skin so it looks younger, fresher, gives you that rosy look of possibly what you used to have 20 years prior.
Right.
It needs to be prescribed, so you need to have it prescribed by your surgeon or work with a medical esthetician. But it is a great way to start.
Good, perfect, great answer. And the last one is for you. And retinol cream is what we've heard a lot about here, so it's a good ticket there for our viewers out there. I'm cursed with crinkles. Is there a surgery that can take care of this? And that's from Amy in Charlotte.
Well, cankles are a challenging thing to deal with surgically.
Explain what cankles are.
I think any woman knows what a cankle is.
Any woman knows that, yeah.
It is. It's thick ankles,
Right.
without having the nice swoop from the calf down to your foot. So what that is, it can be underlying thick bones, or it can be fat deposition in the area. Now, if it's fat deposition, if you can reach down and pinch a couple of centimeters or 3/4 of an inch,
Right.
that is an area that might be fixed with liposuction. Now, it's a challenging procedure and it takes a long time to see the final result, but you can have permanent results from liposuction of the ankles.
I love that. So you guys have answered all the questions, and I know you had surgery all day, as you always do, and office visits, and that busy family going on. So we appreciate you always taking the time to stop by our set. I get so many questions. Our viewers love you. So we'll see you back very soon.
Thank you very much.
Love being here. Thank you.
We hope that you enjoyed the Dr. Criswells tonight, and you keep sending in those viewer questions. We love it. First of all, it lets us know that you're watching, and it also helps us bring to you the answers that you want. So keep watching, tune in, and send those questions.